Hello everyone, welcome back to my channel. This is Dr. Maha Waqar and you are watching Versatile Maha. So guys, today I'm back with yet another health video of mine, and today's topic of discussion is going to be about urinary tract infections. Which is also called as UTIs. So I think many of you must be already familiar with the term, and this is such a common illness, such a common disease right now that a lot of people, especially women, they go through it at least once in their lifetime. So today we are going to be discussing about that, and before I proceed, let me give you the same reminder guys, do subscribe to my channel and hit the bell icon so that every time I post a new video you get a notification. So that was that. Now let's talk about as to what urinary tract infection is. Urinary tract infection is the infection, like the name itself says, the infection of the urinary tract, which involves urinary bladder, the ureters and the kidneys. So UTIs are more common in females as compared to males, and that is because of shorter urethra in females as compared to males. So before I proceed any further, let us understand as to what the anatomy of urinary system is, so that we could get a better understanding. So guys, this hole is the urinary system. Like you guys can see, these are the kidneys. From kidneys we have the ureters, which carry urine from kidney into the bladder. This is the urinary bladder, and here we have urethra. Now when we're talking about UTI, mostly infection starts over here, that is in the urethra and in the bladder. So when the bladder is infected, it is called as cystitis. If the ureter is infected, it is called as urethritis, and when the kidney is infected, it is called as pyelonephritis. So when the infection lies over here, that is in the urethra and bladder, it is called as lower urinary tract infection. And when the infection it ascends upwards, it is called as upper urinary tract infection. So what happens is, most of the time the infection is usually in this area, and people take treatment accordingly and it gets fine. But what happens if sometime people are careless enough and they don't take the treatment at proper time and they delay the treatment? So the infection it ascends upwards. From bladder it goes into the ureter, causes urethritis. From ureter it goes to the kidney, causes pyelonephritis. So when this infection ascends upwards, it leads to pyelonephritis, and then the situation worsens. Then people will have to get admitted and a proper treatment is to be taken. So that becomes serious. So to avoid that, we'll have to contain the infection when it is in this region. Seek the treatment as soon as you start experiencing the symptoms, because if it is not taken care of, it will lead to pyelonephritis. So if you guys can see, this here is the female urinary system, and here we have the male urinary system. In female urinary system, you can see here is the urethra, very fine. Here we have the vagina, see, so close to the urethra, and here we have rectum again. All these are so close to each other. And urethra in females, you can see so small, it is of around 4 cm in females. And here now, if we come on to the male urethra, you can see so long, it is around 20 centimeters in male. So that is the reason females are more prone to getting UTI as compared to males. So I think now you guys have gotten a pretty good picture as to what the urinary system is and how it functions, and why females are more prone to this disease as compared to males. So let's talk about the symptoms of urinary tract infection. So the first symptom which usually females experience is very common. It's frequency. Frequency means an increase in the number of times they have to run to the washroom. Number 2 is urgency. Urgency, what does the word urgency mean? It means that the person usually feels a sudden urge of urinating. So they suddenly have to rush to the washroom, so that is called as urgency. Now third is burning micturition. Usually they have this feeling, usually they experience pain or burning while they are urinating. And number 4 is that they have this feeling that they have not completely urinated and there is still some urine left in their bladder. So that is the feeling which they experience, and it becomes very irritating. So these were the common symptoms which usually people experience. Now let's talk about acute UTI. Usually in that people experience fever. Fever can also be there. There could be low back pain, and there could be blood in urea, which is also called as hematuria. And nausea, vomiting is also there, and pain in lumbar region. So these are the symptoms which are of acute UTI. And then if someone suffers from these symptoms, then it means that the condition is a little serious and they need help as soon as possible. So let's talk about the risk factors of UTI. First is very common, poor local hygiene. Like I already told you guys before as to how to maintain vaginal hygiene, same those conditions would apply here as well. And apart from vaginal hygiene, urethral hygiene is also very important. And second is public toilets, usually the places where people void urine and go to the washrooms. Usually they are not very clean, usually in schools and colleges. So I would suggest that always keep sanitizer spray, that as to, because when people tend to hold urine, because some people they avoid public toilets, and when they tend to hold urine, then again it is one of the risk factors for UTI. So one will have to void urine as soon as they get the urge, but then I would suggest that to carry a sanitizer and use it. And third point is the way people wipe once they are done passing their stools or defecating. So the direction in which people wipe, those who wipe their stools from backward to forward direction, and same goes for children as well. While mothers, they clean the diapers of the children, and while they're changing the diapers and cleaning their babies. So if they tend to wipe stools from backwards to forward direction, then it will again cause UTI, because usually the infection, the bacteria which causes infection is E. coli, and E. coli is the bacteria which is found in our gut and is passed in stools. So that is how one can catch UTI. So it is always advised to wipe from forwards to backwards, and that's how they will avoid UTI. And next point, like I told you guys, holding urine for a very long time. Sometimes the people, like I told you, they do not want to use public restrooms and they hold the urine for a very long time, then again it will lead to UTI. So our next point is incomplete evacuation of bladder. Usually it is seen that young kids, they do not evacuate their bladder fully, because either they want to play or they're in a hurry. So that can also lead to urinary tract infections. So these were all the external causes of UTI. Now let's talk about some internal causes. That is usually because of some genetic abnormality or some anatomical reasons, most commonly being vesicoureteric reflux or vesicovaginal fistula. So these are the common ones. So these were the causes and risk factors of urinary tract infection. Now, so let's move on to diagnosis. Since it's a urinary tract infection, the investigation for UTI is definitely urine examination. And urine examination is divided into urine microscopy and culture sensitivity. So what are the findings in urine microscopy? What happens is we can find pus cells, and we can find traces of blood, that is RBCs, and we can find protein. And in culture sensitivity, what happens is the main aim is to identify the organism that is causing UTI. So once we are done, so that is culture. And what does sensitivity means? Sensitivity means that we are going to find the drug, the antibiotic that will affect the organism. That means which organism is sensitive to a particular drug, because some are resistant as well to the antibiotics. So that was about urine examination. Now let's come on to radiological examination. So in radiological examination, we can go for ultrasound, number 1, and number 2, we can do a micturating cystourethrogram. Now what is it? What happens is we usually insert a catheter into the bladder of the patient, and then through the catheter we inject a dye. And once the urine is formed, and then we ask the patient to urinate. Now while the person is urinating, we get a whole picture, and in that picture we visualize as to where the problem is, and if there's any reflux back into the ureters from the bladder. So having said that, I would also like to add that MCUG, that is micturating cystourethrogram, is not a routine examination. We don't do it every time. We do it only in cases of recurrent UTI where the person doesn't seem to improve. They seem to catch infection again and again. So in those cases, we go for MCUG to see as to where the problem is. So this was about radiological examination. Now let's talk about acute pyelonephritis. Now in cases of acute pyelonephritis, like I told you, the symptoms of fever, backache and everything. So in those cases, what is the investigation? We are going to do a complete blood count. We are going to check about serum creatinine and blood urea. So basically that's how we'll know the infection, and also we'll do a renal function test. So while we're talking about investigation, so I'll also like to add as to how to collect a urine sample, because most of the diagnosis is dependent on the urine sample itself. And what happens is usually people get contaminated samples because people do not know as to how to give the sample right. So what happens is, firstly you need to clean your local area with soap and water, and once you've cleaned the area, then take the cup, sample cup, which is supposed to be from the lab, and then take the cup and urinate in the cup. Now how to urinate inside the cup? What happens is people usually, they just straight away they urinate in the cup. That is not to be done. we usually prefer a midstream of the urine. First void a little, and then when the midstream of the urine is there, we'll have to collect the midstream of the urine. And once that is collected, as soon as you've collected the urine, it is supposed to be submitted immediately. Because what happens is sometimes people take the urine, they collect it, and then they've kept it for a few hours, and then they're going to submit it. Then again, this sample will get contaminated and they'll have to submit the sample again. So that is how we'll collect the urine sample, and if it is done right, then the diagnosis will not get hampered and you'll get a good diagnosis. So let's talk about the treatment. Now treatment, basically it consists of antibiotics. And when I say antibiotics, it doesn't mean any antibiotics. One is not supposed to blindly take antibiotics. Like I told you guys before, that culture sensitivity is done. So when I said that sensitivity is done, it means that there are certain bacteria who are sensitive to a particular drug. So only those medicines, only those antibiotics which the bacteria is sensitive to are to be given, and that is prescribed by the doctors. And whatever the doctor has prescribed, only that should be taken, and the patient should follow the whole complete course. Because sometimes what happens is that the symptoms subside and the patient is very happy that we are done and we do not need to take medication anymore. But whole course is to be followed, and once the person has taken the complete course of the medication, and apart from drugs, one has to take a lot of fluids, plenty of fluids intake, drink plenty of water. Points which I'm going to tell you guys. If we follow those points, we will not have to go through all of the pain. So first is drinking lots and lots of fluid. Like I told you guys before, drinking plenty of water is very important. Number 2, do not hold urine. Frequent emptying of bladder, you have to micturate every time you have the urge. Number 3, keeping the local area clean, maintaining the urethral hygiene and local area hygiene is very, very important. Number 4, here I would like to address to a myth that a lot of people think that taking in a lot of cranberry juice helps them to prevent UTI, but that is a myth, and I think it's just futile to waste so much of money on that. So cranberry juice is a no from my side. And then we need to use clean public toilets, and if we don't find clean public toilets, do not hold your urine. Like I told you guys before, that we need to carry those sanitizers and sanitize the area, sanitize the washroom, and then use it. So that's that, maintaining local hygiene. And like I told you, maintaining vaginal hygiene in an earlier video of mine, so do watch that video as well and follow all those steps for maintaining a clean and healthy vagina. Now I'd like to tell you guys as to why should we not ignore UTI. So all this effort which I've done here, I just want to tell you guys that UTI is not an ordinary disease. You just can't ignore it and get away with it. You'll have to be very vigilant, and you have to take all the medication and follow the proper course. So these patients, usually they start with very basic symptoms, common symptoms, but if not taken care, it can lead, the infection, what happens is it ascends up. Like I told you guys in the diagram, that usually what happens is cystitis, we get infection in the bladder. But what happens eventually is, if it's not taken care of, it ascends upwards, it goes to the ureter, and from ureter it might enter the kidney as well. So what happens is, it can lead to pyelonephritis, right, and it can cause renal scarring, and again it may lead to atrophy of the kidney, and which will result in chronic renal failure, which is the worst part, because once kidney goes into chronic renal failure, once it is damaged, then there's no going back, and one will have to find a donor for a kidney transplant. So that becomes really bad. So to avoid all this, one will have to act smart, and one will have to prevent UTI, and one will have to treat it very cautiously and take it seriously. So guys, that was it from my side. I hope this whole video, this whole talk of mine today, it was really helpful to you guys. And if you find it helpful, then do let me know in the comment section. And if you need me to make another video on any related topic or anything, then just let me know in the comment section. And if you really like this video, then give it a big thumbs up and share this video as much as possible, because come on, it's interesting and informative. So guys, that was it from my side. Till then, take care you guys. Bye the byes.